terms of priorities, Christina, for your office, what are some of the priorities that you're looking in the future for, like top 2 or top 3 things that you think is going to be very important for West Virginians across the state to recognize that these are the things that we really need to be focused upon?
I think for my office, we're really starting to shift gears a little bit. Like I mentioned earlier, the Affordable Care Act and health reform has really changed the focus of our office and our priorities. So we're really gearing up. We've always focused on making sure that children and young children receive well child care. We're pretty good at it as a state for babies and infants and school entry.
Sure.
But what we're really interested in taking on for the future is our adolescents are not getting the well child care in the same way that our younger children are, nor are our women.
Yeah.
So we're really trying to think through opportunities that we can take on to increase the well visits for our adolescents and our women. And so that'll be a major focus for us in the next 5 years, I would say. We'll be really taking a look at those kinds of opportunities and what we might be able to do to improve that for the population as a whole.
Absolutely, absolutely. And Dr. Khan, also, when we talk about the practice of pediatrics, we've mentioned a few of the things we wouldn't have thought about a few years ago, things like well child exams and the development of delays, things like oral health. What are some of the things that you see rising in terms of the practice of pediatrics or general practice in this state, but also in the country, as we move more towards integrating population health and the medical care, especially since health reform in action?
Yeah, I think the practice of pediatrics has transformed significantly compared to previous century to now, since I've practiced, as you mentioned earlier, and both you make me sound old. But I think the focus is changing more to prevention. Fortunately, with the immunization programs and stuff, we have controlled a lot of these measles and smallpox and chickenpox and all those things. So the focus is going to be more preventive measures, more behavioral health, and preventive health. So those are the focus. I think we are seeing more autism, we are seeing more behavioral problems, we are seeing more developmental problems, and that is going to be the focus of pediatrics, and that is why having these resources is extremely important for us.
Yeah, and you're right that we know that the biggest cost drivers are going to be chronic diseases, which goes back to obesity and tobacco in essence.
Yeah.
And I almost think that they are the communicable diseases of the 21st century. Because I also, you look at the data and the science, and that shows that if you smoke, you're more close aligned with people who smoke, and same way with overweight and obesity. So they're kind of communicable diseases. They're just not the traditional communicable diseases in terms of organism transfer and that way. So it's interesting that as we move forward, I think the alignment of public health and medical care and then focus on prevention is a lot more. Are there any things, Christina, you mentioned mothers and adolescents a little bit also, because they're a very important part. Dr. Khan sees patients once they're born, but we also know antenatal, which is while the woman is pregnant, a lot goes on, and if that can be impacted, at that point, habits can change, because we believe, I think you would agree, that no time in her life a woman is more susceptible to change and wanting to do what needs to be done for the baby than when they're pregnant.
Absolutely. And we are focusing a lot of efforts on pregnant women. We have our Right from the Start program, which is our program for Medicaid women who are pregnant, and then for their babies up to age 1, where we provide medical case management services for those women and education. I'll also point out that our home visitation program, you don't have to wait to have a child. You can access those programs too while you're pregnant. But I think even more importantly is before the woman gets pregnant. Our family planning program works to assure that women are ready for pregnancy, and that period in her life is a joyful and healthy time and an expectant time for the family that they're looking forward to. So those services just for family spacing and making sure that the woman's ready for that pregnancy before she is even pregnant, I think is one of the most important programs that we offer in our office.
Well, great. I think we've had so much good discussion, almost, the lifetime of individuals. I really want to again, thank you for being here, both Dr. Khan as well as Christina. So thank you so much for being here.
Thank you for having us.
Absolutely. And thank you for joining us. That's all the time we have for today's show. Thank you once again for watching The State of Health here on the Library Television Network. Remember, you can always follow us on our DHHR Facebook, Twitter, and website. I'm Dr. Rahul Gupta, State Health Officer and Commissioner of the West Virginia Bureau of Public Health. On behalf of Secretary Bowling, thank you for watching.